Chronic lymphocytic leukemia is a B-cell lymphocyte malignancy, and the cells are mature, monoclonal, and functionally incompetent cells. Clinically, most patients feel entirely well and with no symptoms, and the first impression in most patients will be found on increased absolute lymphocyte count on CBC, which is done for other reasons, and which leads to the investigation and final diagnosis of chronic lymphocytic leukemia. In patients who have symptoms, they may present with unintentional weight loss, which means someone who is not exercising or not on diet for weight loss, but actually losing weight of significant within just a couple of months, like within 6 months, and having fever, which is usually above 38 degrees centigrade for more than 2 weeks, and having extreme fatigue and excessive sweating in the nights without evidence of other cause of sweating, including infection. And on physical examination, one may find lymphadenopathy, which is actually the most common abnormal finding on physical exam. And most patients will have cervical, supraclavicular, and axillary lymphadenopathies. The other physical exam finding will be splenomegaly, which we are seeing it on the here, and this is also on imaging. And this is the second most common physical exam finding in patients with chronic lymphocytic leukemia. This is post-splenectomy, which is a huge spleen that we are seeing. And the third physical exam finding would be hepatomegaly. Usually we found a mild form of liver enlargement, which is not painful. And other physical finding would be on the skin, leukemic infiltration of the skin. So patients will have macules, papules, or nodules, or plaques, even ulcers or blisters, mainly on the face, but they could involve any part of the skin. So thank you for watching, and don't forget subscribing.